A 26-year-old woman complains of sudden pains in the bottom of abdomen irradiating to the anus, nausea, giddiness, bloody discharges from sexual tracts for 1 week. Delay of menses was for 4 weeks. Signs of peritoneum irritation are positive. By manual examination, borders of the uterus body and its appendages are not determined because of sharp painfulness. The diverticulum and the painfulness of the back and dextral fornices of the vagina are evident. What is the most probable diagnosis? It's a
Mhm.
broken tubal pregnancy.
Yes,
There's
what are the
delay.
signs of broken pregnancy?
There's a delay of menstruation, so
Yeah,
peritoneum and
yeah.
pregnancy, and then there's signs of peritoneum irritation and bleeding
Plus what?
and
Bleeding,
yeah.
yes. Plus bleeding, yes. And fornixes,
Painful.
no, here painfulness of the back and dextral fornixes, yes. And of course, it is broken tubal pregnancy because first of all we pay attention to the delay of menstruation, yes. The next one, number 2, and please, Navjot.
A pregnant woman in her 8th week was admitted to the hospital for artificial abortion. In course of operation during dilation of cervical canal of uterus by means of Hager dilator number 8, the doctor suspected uterus perforation. What is the immediate tactics for confirmation of diagnosis? Uterine probing.
Yes, uterine probing, and then maybe laparoscopy. But first of all, it is, you see here, option laparoscopy. But first of all, it is uterine probing. You remember about it, yes? Number 3. And так, Kaushal Shanil absent, yes? Так, number 4. Khan, please read.
A 22-year-old patient complains of having boring pain in the right iliac region for 1 week, morning sickness, test change, delay of menstruation is 3 weeks, objective arterial pressure is 100/70, and PSA is 70 per minute, temperature 37. By manual examination, revealed the uterus is little large, soft, movable, painless, appendages palpable, pain formation 3 into 4 centimeter large on the right. It is dense and elastic, readily movable. It is a diagnosis. It's ectopic pregnancy, like progressing tubal pregnancy.
Yes, here we have progressing tubal pregnancy, but we have here interrupted tubal pregnancy, and we have uterine pregnancy. Why it is this progressing tubal pregnancy, but not interrupted and uterine pregnancy? Can you prove me?
There's it's a pain in the right iliac region.
No, maybe if it is progressing interrupted tubal abortion, for example, also maybe this pain.
First
If
of
it
all,
is
it's delay
pregnancy,
in menstruation. There's a reason.
no
Menstruation.
reason. Interrupted tubal pregnancy, women also have a delay of menstruation, guys. What we have here, if it is так, guys, maybe such question, progressive tubal pregnancy. If the woman pregnant, we have delay of menstruation, but it's maybe uterine pregnancy, it's maybe interrupted tubal pregnancy, or progressing tubal pregnancy. Yes, if it is progressing, there is no bleeding. Yes, as egg inside the tube fallopian, yes, and growth without rupture of the fallopian tube, and there is no signs of hemorrhagic shock. Normal BP, arterial pressure, they told you, normal pulse, temperature 37. It is influence of progesterone. It means that woman is pregnant. Yes. Little enlarged of the uterus, often available, maybe pregnancy uterine, maybe. I told you to my mind that if it is ectopic pregnancy, uterus also slightly enlarged. Why? Because endometrium, internal layer on the uterus, pass this transformation to the decidual layer. The decidual layer is very thick. These changes happened in the uterus and it seems that it is uterine pregnancy. But changes of endometrium happened not only in the fallopian tube where we have fetus egg. In the uterine cavity also we have the changes of the endometrium and changes to the pseudo layer, which has very thick length, thick endometrium, yes, and that's why even if it is ectopic pregnancy, uterus also slightly enlarged. But what else we have? We have no signs of hemorrhage. That's why it cannot be ruptured, the fallopian tube. But during bimanual examination, we have painful formation, 3 to 4 centimeters on the right side, dense and elastic and moderately movable. And that's why probable diagnosis, it is progressive, not interrupted. If it is interrupted, will be bleeding. If it is uterine pregnancy, they don't give you that the uterus have on the right side of the uterus, we have formation, enlargement of the appendages. But question is very provoked. All kinds of pregnancy are present here in this question. Thank you. The next, number 4, and Mandeep Singh present.
Yes, teacher.
Read, please.
A woman complains of having slight dark bloody discharge and mild pain in the lower part of abdomen for several days. Last menses were 7 weeks ago. The pregnancy test is positive. By manual investigation, the body of the uterus indicates for about 5 to 6 weeks of pregnancy. It's soft, painless. In the left appendage, there is a retort-like formation, 7.5 centimeter large, mobile, painless. What examination necessary for detection of the fetus localization? Ultrasound, please.
Of course, ultrasound. We don't sure if it is pregnancy in the uterus or it is pregnancy in the fallopian tube. That's why first of all we begin from ultrasound. The next, number 5, and please, Vilima.
A 40-year-old female patient has been observing excessive menstruation accompanied by spasmodic pain in the lower abdomen for a year. By manual examination performed during menstruation revealed a dense formation up to 5 centimeters in diameter in the cervical canal. Uterus is enlarged up to 5 to 6 weeks of pregnancy, movable, painful, of normal consistency. Appendages are not palpable. Bloody discharge are profuse. What is the most probable diagnosis? Nascent submucosal fibromatous node.
Guys, I don't even want to explain because many times I explain you this condition, but pay attention. She suffered from this pain for a year. It's not immediate because it is fibroid. Yes, it cannot happen at one day, the formation of the fibroid. Yes, and due to the increase of the size or if the fibroid has long pedicule and during physical load may be inclination of fibroid in the cervical canal, and fibroid begin dilated the cervical canal. We have here this situation. Yes. What are the main in this? What are the signs of fibroid? Can you tell me?
The uterus is enlarged like 5 to 6 weeks.
But more significant, guys. Hear your sentence. Dense formation in the cervical canal. Yes, 5 centimeters. Yes, diameter in the cervical canal. This fibroid begin dilated the cervix. Yes. What we need to do if we set the diagnosis of fibromatous nose, which is bone, which can be bone, nascent mucosa? What we need to do with this? Can you tell me, William?
What's that, teacher?
What our management if we have this diagnosis?
Laparotomy.
Huh?
Surgical removal. Laparotomy.
How we make the surgical removal? With the help of what? We grasp this notch with the help of the forceps, yes, uso, for example, and make the torsion. If it is cannot help us, if our efforts fail you, we need to perform hysterectomy. We remove the uterus, yes. Now, cervical myome, guys, located inside the tissues of the cervix. We cannot separate the cervix from the uterus through the vagina. If it is fibroid in the cervical canal, it is fibroid on the crus. This fibroid from the uterine cavity, it grows from the uterine cavity. It is submucous node on the crus. That's why we can perform torsion. Cervical myoma, it is the tissues of the cervix. That's why we cannot make the torsion of the cervix. Understand? But fibroid, it is separate. It is growth from the cavity of the uterus. Guys, number 6, and please, Mahanti. Yes, no, remember about it, guys, and be very, very attentive during reading the KROK test. Number 7, Natalia, Eutemia.
Okay, a 24-year-old female patient complains of acute pain in the lower abdomen that turned up after a physical stress. She presents with nausea, vomiting, dry mouth, and body temperature, which is 36.6 degrees Celsius. She has a right ovarian cyst in history. Bimanual examination reveals that uterus is dense, painless, of normal size. The left fornix is deep, uterine appendages and palpable. The right fornix is contracted. There is a painful formation on the right of uterus. It is round, elastic, and mobile. It is 7 by 8 centimeters large. In blood, leukocytosis with the left shift. What is the most likely diagnosis? This is the ovarian cyst with pedicle torsion.
Eutemia, can you tell me what operation we need to do in this case if we have cyst with torsion of the cyst?
Okay, in this case, we do a laparoscopic operation.
And what we need to do?
And cut, you have to cut the ovary plus the
yes, without retorsion of the pedicle, guys. And how we name this operation? Maybe they ask you what to do. Cystectomy, yes? Cystectomy, which is the cutting of the cyst, but cystectomy, the name of this operation, yes. Why it is present of the cyst? Because uterus no changes, but on the right part we can see painful formation, round, elastic, mobile. Usually it is the signs of the cyst, yes, increase of the ovary 7 to 8 centimeters, plus appearance of sudden pain, noisy vomiting, dry mouth, body temperature normal, yes, no inflammation, but it is the torsion, yes. And you see they pointed you that she has a right ovarian cyst in the history. In the history. The next, please, number 8. Thank you, Temia. Number 8, it is Nidhi.
22-year-old
Nidhi
female
present.
patient. A 22-year-old female patient complains of dull pain in her right iliac area that she has been experiencing for a week, morning sickness and gustatory change. She has a history of menstruation delay for 3 weeks. Objectively, arterial pressure 80 by 50 mm. Pulse is 78 beats per minute. Body temperature is 37 degrees centigrade. Bimanual examination reveals that uterus is enlarged, soft, mobile, and painless. Uterine appendages are palpable on the right. There is a dense, elastic, and moderately painful formation, 3 into 4 centimeter. Large. What is the most likely diagnosis? It's progressing fallopian pregnancy.
No, we have the repeated of the question. We have why it is not interrupted fallopian pregnancy or uterine pregnancy? Can you tell me?
There is a
Options.
mobile, soft, and painless.
Painful formation.
Dense, elastic, and moderately painful, 3 into 4 centimeter.
No, why it is not interrupted fallopian pregnancy? What are the main signs if it is interrupted fallopian pregnancy? What complaint woman has? What
There
symptom?
will be
Will
hemorrhage to peritonite.
hemorrhage, you are quite right. There is no bleeding. We have only growth pregnancy inside the fallopian tube. Yes, uterine pregnancy. No, if it is in the case of uterine pregnancy, there is no this formation. Yes, that's why we suspected progressive tubal pregnancy. Number 9, please, Yamin.
A patient with uterine fibromyoma sized up to 8 to 9 weeks of pregnancy consulted a gynecologist about acute pain in the lower abdomen. Examination revealed pronounced positive symptoms of peritoneal irritation, high leukocytosis. Vaginal examination revealed that the uterus was enlarged up to 9 weeks of pregnancy due to fibromatous nodes, one of which was mobile and extremely painful. Appendages were not palpable. Discharges were mucus coming in moderate amounts. What is the treatment? Laparotomy, urgent surgery, yes.
What is the diagnosis here?
So it's a complicated fibromyoma.
What complication usually we have? Just we have the topic and I told you what complication will be that she has acute pain. In the history she has fibromyoma. They write you this, yes, 8 to 9 weeks of pregnancy, fibromyoma size, but suddenly acute pain, yes, in
So
the
there
lower
could be a rupture, right?
No.
No.
Fibromatous node has dense consistence. It not can be ruptured. It may be what? How we name the disorders of nutrition of the fibromatous node?
Can it be torsion?
It may be torsion if the fibromatous node on the cruise, but there is no any sign. It is maybe necrosis of the fibromatous node, guys. It is necrosis, clinical picture of necrosis of the fibromatous nodes. Of course, it needs in urgent surgery. Number 10, and please, Pretty. Pretty present.
Yes, teacher, present. Teacher, but I can't see your question.
Sorry, please read the test.
I can see now.
Pretty. Yeah.
A 28-year-old patient has been taken to the hospital for acute pain in the lower abdomen, and there was brief syncope. The delay of menstruation is 2 months. Objectively, the patient has pale skin, arterial pulse 90 by 50 millimeter mercury. Pulse is 110 per minute. Lower abdomen is extremely painful. Vaginal examination reveals uterus enlargement. There is positive prompt sign. Right appendages are painful and enlarged and very painful. Posterior vault hangs over. What is the most likely diagnosis? It's right-sided tubal pregnancy.
We have right ovary apoplexy. Why it is not apoplexy? Can you tell me, Pretty?
Teacher, apoplexy means rupture of the ovary, so there will be hemorrhage.
Not. No, hemorrhage maybe if it is apoplexy, hemorrhage maybe if it is ectopic pregnancy.
Delay of menstruation they will be given.
Yes, delay of menstruation should be. Yes, prompt of sign. Who know what does it mean, prompt of sign, guys? Or maybe pretty know.
It is related to peritoneal irritation.
No, peritoneal irritation, it is symptom Bloomberg щетки. A promptum, it is removal of the cervix upward can cause profuse pain. It is the signs of any catastrophe in the cavity of the small pelvis and reveal very often if we have ectopic pregnancy. Guys, I want to pay you attention to this test because here there is no any word about the bleeding, yes, which woman has, but pay attention to objective examination, pale skin, BP 90-50, acceleration of the pulse. It is the signs in most of cases of hemorrhage, yes. They don't give you evident sign, evident symptom, it is bleeding, but they give you the signs of hemorrhagic shock, yes, in this case. That's why right side tubal pregnancy. No, provoke, I want to say. Incipient abortion. No, in this case also maybe hemorrhage, but and they told you that uterine enlargement present. But first of all, you pay attention to enlargement and very painful appendages and signs of any urgent conditions. If it is incipient abortion, present bleeding, maybe signs of hemorrhagic shock, but very rare at all, absent symptoms of irritation of the peritoneum. Symptoms of catastrophe, absent prompt of sign, absent Shotkin-Bloomberg sign. Number 10, and please, Suresh, read the test.
Teacher, we just did this 10.
Excuse me. Так, number 11. It is the last one.
A 36-year-old female presented to a gynecological hospital with a significant bleeding from the genital tract and a 1-month delay of menstruation. Bimanual examination revealed soft barrel-shaped cervix. Uterus was of normal size, somewhat softened. Appendages were unremarkable on both sides. Cyclosum examination revealed that the cervix was cyanotic, enlarged with the external orifice disclosed up to 0.5 centimeter. Urine HCG test was positive. What is the most likely diagnosis? It is cervical pregnancy.
It is cervical pregnancy, because why it is not uterine gestation that they told you, or abortion in progress, guys? Why it is not, for example, or threatened miscarriage or ectopic pregnancy? First of all, to what? Pay attention, this woman is pregnant, yes, because we have delay of menstruation, we have positive chorionic test, yes. Then test on pregnancy, uterus, and we have no changes on the side of the ovaries, on the appendages, yes. That's why we don't speak about the tubal pregnancy, but we have changes of the cervix. It is cyanotic sign of pregnancy, yes. Enlarged barrel shape usually they give you if we speak about the ectopic pregnancy. It is closer up to 0.5 centimeters of the cervical os due to the over distension of the tissues of the cervix, yes. To my mind it is difficult, but you need to remember cyanotic barrel shaped cervix with normal appendages and normal size of the uterus, and plus positive chorionic test, cervical pregnancy. Remember about it, guys. For the next classes, it will be topic infertility and contraception. Infertility, pay attention to the classification. It is a very good question. Apoplexy usually happened in the middle of the menstrual cycle. That's why there is no delay of menstruation. which they give you in test. If they write you that this menstruation was 2 weeks ago, it means 2 weeks ago, it is middle of the menstrual cycle, and appear this bleeding, it is apoplexia. If they write for you it was delay of menstruation, usually it is ectopic pregnancy, understand? Apoplexy, no delay of menstruation. And that's why they told you that menstruation was 2 weeks ago, no delay, yes? If it is ectopic pregnancy, there is delay of menstruation. Apoplexy happened in the middle of the menstrual cycle. Ectopic pregnancy after the delay of menstruation. Understand, guys? Guys, about the next topic, it is infertility. Pay attention. What does it mean, infertility? Definition. It's very significant. If you don't know this definition, you cannot set right diagnosis in proper way. Then it is classification. What does it mean tubal? What does it mean endocrine? What does it mean uterine infertility? What does it mean cervical or immunological infertility? Then the techniques, modern techniques of fertilization. And of course, groups of contraceptive drugs. Yes, classification of contraceptives. What kind of contraceptives do you know? And guys, on Monday it will be final attestation. If you don't attend this attestation, I cannot put your credit at all. Attestation will be very short. I ask you, I don't know exactly when it happened. I need to be in the hospital on the meeting. That's why on Monday you need to be at 10 o'clock, begin our attestation. Only 2 questions. One, obstetrics, other from gynecology. But internet connection is... No, and for tomorrow, prepare infertility, guys. We'll speak about the infertility, and if it is possible, I want to show you very fantastic, to my mind, film. It is pregnancy in 6-year-old girl. Yes, pregnancy and labor. It is a film of 34 years. Yes, 1934. Very old, but it is interesting. Have you seen this film or not, guys?
No.